Alright, next we can look at your knees. So just looking at his knees here, we're looking for symmetry. We're making sure that there's no edema, any redness, any indentions where it may look as though there's in the synovial joint kind of thing, or any maladies. We're making sure that there's no ticklish. I'm sorry, y'all. Palpate the patella and just look and feel that everything appears symmetrical and normal. Move your hands, darling. Okay, so what we're going to have you do is extend your leg out for me. Great job. And then lower down. Just feeling for any types of crepitus at the joint. Again, lift your leg out for me. And then slowly lower it back down. Great job. Okay, next we're going to take a look at your ankles. Yes, you're doing a very good job rotating your ankles. So we're going to take a look at Caden's ankles. We're going to have Caden try to do range of motion in just a moment. But first we want to inspect both the ankles together, making sure that there's no edema, no redness, no ecchymosis, which could indicate that he's had an injury at the site. We are palpating the lateral and medial malleolus, making sure that everything feels intact there on both ankles. Okay. Palpating further down, making sure that there is a good peripheral circulation down into the foot. We can check for his capillary refill in each of his toes. And again, with those, it's less than 2 seconds on all of his toes. There's no nodules, no lesions, no signs of gout or swelling, any edema in his toes at all. They look normal. Again, on this foot, checking for capillary refill, any nodules, gout, lesions of any kind. But none of those are present. So we will have Caden do some range of motion for me. So Caden, if you can flex your foot up towards your nose. Good job. And then point your toes down for me. Good job. Can you try to turn your heel to the inside? Turn the bottom of your foot in. There you go. And then turn it out for me. Good job. Any pain when you do that? Okay. And then looking at the toes on his foot, I'm going to ask Caden if he will lift his toes and point his toes. Point just your toes. Okay. Try to squeeze your toes together and separate as far apart as you can. That's wonderful. So he has great range of motion in this foot with both abduction and adduction, flexion and extension, and inversion and eversion of the ankle. So on this foot, we're going to have him do the same thing. We're going to have him point your toes up towards your nose. So lifting up with the ankle, any pain there, okay? We're going to have you point your toes down to the floor. That's great. Any pain when you do that? Great. And turning the bottom of your foot in and out for inversion and eversion. And then with your toes, if you will kind of scrunch them up, there you go, flexion and extension, extend them out. Extend them out for me. Good job. And then if you will try to spread them apart as much as you can, and then back together for adduction. Good job. Great job, Katie. Alright. The next thing we're going to look at is your spine. Can you stand up for me? Thank you. We're going to turn this way. So just looking at Caden we can see that he's got a normal curvature of his spine. That's a good S curvature there. And just starting down around C7, we'll just palpate down each vertebrae, making sure that there are no vertebrae that are protruding or that have indented in, which could indicate that there is a slippage of the vertebrae of the column, all the way down to his sacrum. Okay. All right, buddy. We're going to turn and we're going to have you bend and touch your toes. Okay. And just looking at the spine, making sure that there is just the normal C curvature, that there's no extra curvature or twisting of the spine, that there's symmetry across his back, that one scapula is not more elevated than the other. That could indicate any type of scoliosis, that everything looks very well aligned. You can also, can you go over a little bit more for me, buddy? You can also look at this time at the hips, making sure that they are in the proper alignment, that one hip is not more elevated than the other. All right, you can stand back up for me. And then if you'll just turn, and if you can kind of lean back so we can see some extension. Okay, good job. Stand up. And then let's check Caden, as long as nothing is painful to you. Turn this way for me. If you will just turn, and let's do some lateral bending. So we're going to bend to the side. Okay, and then to the other side. Good job. And then one final thing I'll have you do for your spine is to twist. That's right. All right, any pain when you do that? That's wonderful. Now, the next thing we need to do is check your hips, okay? So if you'll lay up here on the table for me. And let's check your hips, okay? We're going to check your trochanter's and make sure that everything feels like it's in line. Any tenderness when I press there? Just a little ticklish, huh? Okay. So we will take one of Caden's legs and ask him to flex it up for me. So flexing it up in the air, okay, and then down for me. Okay. And then this leg as well, up and then down. Thank you. And then we're going to check for abduction and adduction. So we'll have Caden. Caden, if you will take this leg and open it out for me. Any pain when you do that? Okay, and then cross over for me. Any pain in your hip? Okay. Lay that leg down. Let's do the same thing on this side. So open up your leg. And then we're going to bring it across the other leg. Any pain when you do that? Okay. Bring this leg back down for me. Now we're going to check for internal and external rotation. So if you will take this foot and place it here at this knee. And so for internal rotation, we'll just have this leg just rotate inward medially. And then for external rotation, we'll have this leg go out for me. Does that feel okay? Okay. And then down. And let's try this other side, okay? So for internal rotation again, we'll have it cross the body there. And then for external rotation, we'll have this leg drop down. Does that feel okay? Excellent. One final thing for your hips, if I can get you to turn over on your tummy. We just need to check extension of the hip as well. So if you'll lift this leg straight up, hold on, bud, hold on. Try to keep your knee straight for me, okay? So straight up. Does that feel okay? Okay, and then on this side as well. Okay. All right, put that down for me. All right. Okay, thank you, Kevin. You can turn back over more comfortably, okay?